Thank you, Vice Chair Liu. It's really an honor to be here, but the reason is outrageous. And I want to express that outrage on behalf of my constituents. That the Republicans at this moment are attempting to make the largest cut ever in Medicaid and the largest cut ever in SNAP. That would be $715 billion out of Medicaid, which would kick 13.7 million Americans off of their health insurance. And let me just reiterate, why are they doing this? They are doing this to pay for a tax cut for the wealthiest Americans like Elon Musk. It is morally bankrupt, and it is fiscally incredibly irresponsible. We just spent 26 and a half hours in the Energy and Commerce Committee last week, spending the vast majority of that time, and by the way, starting at about 2 o'clock in the morning, talking about these cuts to Medicaid and how they would devastate our constituents and also the broader healthcare system. I want to be clear, 1 out of 3 Washingtonians depend on Medicaid. Most of them don't even know they're on Medicaid because we call it Apple Health. And I'm trying to make that point so that people understand how this impacts them personally. So I think about, as a pediatrician, I think about my patients on Medicaid or on Apple Health who will no longer be able to come to their pediatrician's office for screenings, for a simple cold, for a cough, and get treated in a half hour. Now they're going to go to the emergency room, the most expensive place to get care. They're going to drive up costs. That cost will be provided for free, and then everybody pays. And I think then about my patients who are not on Medicaid, because they're going to be waiting longer in the emergency room. They're going to be paying more. Premiums are going to go up if we want to keep these hospitals and emergency rooms open. And that brings us to other parts of my district, the rural areas, where hospitals may close because they depend so heavily on Medicaid and Medicare. I want to tell you a quick story of a little 4-year-old girl named Isla in my district. She is the outcome of a normal, uneventful pregnancy. She was lucky enough to go to our rural hospital called Kittitas Valley Healthcare, and they have a labor and delivery department. She was delivered. There were major complications. She almost died, but they had the staff and the expertise to rescue her, to stabilize her, and to life flight her to Seattle Children's. And then I have been reflecting, as have her parents who are insured, about what would have happened had Medicaid been cut, had labor and delivery there been cut, had she not had that opportunity for rescue and for transport to save her life. And we all know what the answer would have been. I've been in hundreds of deliveries. Some go well, some don't, and you don't always know until that moment. So I want to emphasize Medicaid is part of the 3-legged stool that is our healthcare system. If Medicaid is cut in this dramatic way, that stool will fall. It'll mean hospital closures, higher rates for all of us, emergency room long waits, a sicker community, and a poorer community, and it is reckless and morally reprehensible.